Assalamu alaikum wa rahmatullah wa barakatuh. My lecture in parasitology. Today I'm going to talk about blood and tissue protozoa. Class Hemoflagellate, specifically about Trypanosoma species. Let's start with scientific classification of Trypanosoma. Trypanosoma belongs to phylum Protozoa, class Mastigophora, order Kinetoblastidae, family Trypanosomatidae, genera Trypanosoma. Species. In my lecture I will focus about 3 species of Trypanosoma. They are Trypanosoma cruzi, Trypanosoma bruzi-gambiens, and Trypanosoma bruzi-rhodesians. Let's move to talk about Trypanosoma properties. The features of this family are: there are various forms developed during their life cycle. Also, there are 2 hosts involved in their life cycle. These are reservoir host, could be human or animals, and vector host, always insect. Trypanosomatidae multiply by longitudinal binary fission. However, in the Trypanosoma bruzi, there is an evidence of the genetic exchange during development within the vector, which indicate sexual reproduction. In this slide, I will talking about the morphologic forms of Trypanosoma. There are 4 morphologically differentiated forms involved in the life cycle of Trypanosoma. 3 of them are spindly uniflagellate. These are Trypomastigote, Epimastigote, and Bromastigote. The 4th one is a rounded, called a mastigote form. How I can differentiate between these forms? Let's see. The Trypomastigote form of the genus Trypanosoma has the following characteristic features. It has a central nucleus and an elongated mitochondrion containing the kinetoblast in its posterior section. Kinetoblast is a network of cellular DNA called kDNA inside a large mitochondrion that containing many copies of mitochondrial genome. Close to but outside of the mitochondrion, also we can find the base of the flagellum, which originates in the plasmatic basal body. In the epimastigote and bromastigote forms, the kinetoblast and base of the flagellum are near of the nucleus or more toward the anterior end. In the amastigote form, a reduced flagellum is visible by electron microscopy, but it does not emerge onto the cell surface. As I mentioned previously, today I'm going to focus on 3 species of Trypanosoma. These are Trypanosoma gambians, Trypanosoma rhodesians, and Trypanosoma cruzi. Let's start with Trypanosoma gambians and Trypanosoma rhodesians. Both of them are the causative agents of African trypanosomosis, sleeping sickness. The morphology and life cycle of the two species are similar. The vector is the tsetse fly, Glossina, but different species of fly are involved for each. Human are the reservoir for Trypanosoma gambians, whereas Trypanosoma rhodesians has reservoir in both domestic animal, especially cattle, and wild animals, example, antelopes. This slide shows the life cycle of Trypanosoma gambians as well as the life cycle of Trypanosoma rhodesians. As I mentioned previously, there are two hosts involved in the life cycle of them, which means the life cycle of Trypanosoma includes two parts or two stages. One in the vector host and another in the reservoir host. In the vector, this stage takes 3 weeks of the life cycle. In the tsetse fly, Glossina begins with ingestion of trypomastigote in a blood meal from the reservoir host. They multiply in the insect gut and migrate to the salivary gland, where they transform into epimastigote and multiply further, and then form metacyclic trypomastigote, which are transmitted to the reservoir host by tsetse fly bite. In the reservoir host, second period of the life cycle, it started when the trypomastigote in the saliva of the vector host are injected into the skin of the reservoir host. They enter the blood stream and pass into lymphatic system, where they differentiate into blood-form trypomastigote and multiply, thereby completing the life cycle. Eventually, the invasion of the central nervous system may occur. The trypomastigote are transmitted back to the tsetse fly when feeds on an infected human. Notes: these species are rarely found as a mastigote in tissue, in contrast to Trypanosoma cruzi and Leishmania species, in which a mastigote are commonly found. This slide shows clinical findings of African trypanosomosis, sleeping sickness. Although both species cause sleeping sickness, the progress of the disease differs. Trypanosoma gambians induced disease runs a low-grade chronic course over a few years, whereas Trypanosoma rhodesian causes a more acute, rapidly progressive disease that, if untreated, is usually fatal within several months. The initial lesion is an indurated skin ulcer, Trypanosoma chancre, at the site of the fly bite. After the organism enters the blood, intermittent weekly fever and lymphadenopathy develop. Enlargement of the posterior cervical lymph nodes, winter bottom sign, is commonly seen. The encephalitis is characterized initially by headache, insomnia, and mood change, followed by muscle, tremor, slurred speech, and apathy that progress to somnolence and coma. Untreated disease is usually fatal as a result of pneumonia. Now I am talking about treatment of sleeping sickness. Treatment must be initiated before the development of the encephalitis because Ceramine, the most effective drug, does not pass the blood-brain barrier well. Ceramine will effect a cure if given early. Pentamidine is an alternative drug. If central nervous system symptoms are present, Ceramine to clear the parasthenia, followed by milasoprol should be given. In this slide, I will start to talk about the third species of Trypanosoma, the Trypanosoma cruzi. Trypanosoma cruzi cause Chagas disease, American trypanosomiasis. The vector is the Rudolph bug, Trypanosoma connos or kissing bug. Also, there is a reservoir host in the Trypanosoma cruzi life cycle. So the reservoir hosts both human and animals. The animals is domestic cats and dogs and wild species such as the armadillo, raccoon, and rats. This slide shows the life cycle of Trypanosoma cruzi. As you see in the figures, and as I mentioned in the previous slide, the life cycle of Trypanosoma cruzi involves the Rudolph bug, Trypanosoma connos or kissing bug as the vector, while both the human and animals as reservoir host. The animal reservoirs include domestic cats and dogs and wild species such as the armadillo, raccoon, and rat. The cycle in the Rudolph bug begins with ingestion of trypomastigote in the blood of reservoir host. In the insect gut, they multiply and differentiate first into epimastigotes and then into trypomastigotes. When they reach to the head gut, the trypomastigotes are passed within the feces. When the bug bites again, the site is contaminated with feces containing trypomastigotes. As the host scratched the bite area, the trypomastodon conveniently gained entry into the host. Additional routes of Trypanosoma cruzi transmission include blood transfusion, sexual intercourse, transplacental, and entry through the mucous membrane when the bug bite occurs near the eye or mouth. Following entry into the host, trypomastodon invade surrounding cells, where they transform to the non-flagellate mastodon form. Within reservoir host cells, the mastodon proceed to multiply, destroy the host cells, then converted back into trypomastodons, resulting trypomastodon migrate through the blood, penetrate additional cell in the body, transform back into mastodons, and the cycle repeats. Many cells can be affected, but myocardial, glial, and reticular endothelial cells are the most frequent sites. Trypomastodons, which enter the blood, are taken up by the Rogevid bug again. This slide shows the clinical findings of Chagas disease. The acute phase of Chagas disease consists of facial edema and a nodule chacoma near the bite, coupled with fever, lymphadenopathy, and hepatosplenomegaly. The acute phase resolves in about 2 months. Most individuals then remain asymptomatic, but some progress to the chronic form with myocarditis and megacolon. Death from chronic Chagas disease is usually due to cardiac arrhythmias and failure. Now, I will talk about the treatment of Chagas disease. The drug of choice for acute phase is nifurtimox, which kills trypomastodons in the blood, but is much less effective against a mastodon in tissue. Benzimidazole is an alternative drug. There is no effective drug against the chronic form. Thank you for listening. If you have any question, please ask me.